Good afternoon and welcome to our Plymouth COVID-19 update number 102. I'm Steve Triffletti and it is August 11th. It is 12 noon and as your town moderator will be here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. And you can also watch this on PAC TV's streaming channel by going to pactv.org/live. Today, for questions, you can email plymouth.info@pactv.org. These forums are replayed at pactv.org/Plymouth. And today's participants joining Plymouth Representative Matthew Muratore include Dr. Barry Potvin. He is the chair of the Plymouth Board of Health, and Dr. Philip Triffletti. He is an attending physician at Beth Israel Deaconess. And at this time, we're going to begin with Dr. Philip Triffletti. Welcome. Dr. Phil.
Yes, Stephen, thank you for having me today. I am going to start by talking about booster shots for COVID-19. And I've been getting a lot of interest from my patients about this. I heard on the news this morning that the advisory committee for the CDC for vaccinations is going to meet on Friday. And at that time, they'll be discussing boosters, getting a third shot for COVID. And I've noticed a lot of people are nervous because they hear different reports about how your antibody levels might decline over time after you've had your shot. But I like to reassure people that your immunity is made up of more than just the antibody levels themselves. So there's a thing called T cells, which are memory cells, which are another important part of your immunity, so that people might have antibody levels in the bloodstream that it's dropping, but they might still have just as robust, just as strong an immune response, even at the lower antibody levels. So, everyone is really watching this very carefully to make sure that, the vaccines are still working. As we know, the vaccines are still very effective at preventing hospitalizations and deaths from COVID-19 in people who've been vaccinated. So, it's not a 100% guarantee. We'll talk a little bit more about that, but they're very, very effective. The biggest group that really has to worry about it are people who are immunocompromised. And that would be people that, maybe they had an organ transplant for a kidney or something, or they've got very bad immune system from chemotherapy. Maybe they have got active leukemia, active lymphoma, maybe a kidney dialysis patient. These are people that are much higher risk of getting infections. In fact, when you look at the people who get breakthrough infections, that means people who have been vaccinated, but then got COVID-19 after being successfully vaccinated with both shots, about 40% of the group that actually gets the breakthrough infections in a lot of the studies, including places like Israel, about 40% of them have been people who are immunocompromised. So that's really what that CDC advisory panel, I think, is going to be looking at. Dr. Fauci mentioned it this past week, that you may see a recommendation for a third shot, really for the immunocompromised high-risk group. I think if you look across the board, what's the risk of a breakthrough infection? There's been some studies where if you look at healthcare workers, and they did a study in Israel, and that's probably the best circumstance where people are wearing masks and taking all the precautions to prevent infection, you might see a rate of maybe 2% breakthrough infections. If you look at people who have been completely immunized and they're very healthy, they have a normal immune system, maybe there's a 10% risk of a breakthrough infection. And then for people who are immunocompromised, the risk of breakthrough infection, as I said, is about 40%. So that particular group is where you'll be getting the biggest focus to start. In Israel, for instance, though, they also looked at age groups, and they've decided to give the booster, the third shot, to people who are over age 60. And I'm not sure if you'll see that addressed by our CDC this week, but probably, in the coming months, it's probably likely eventually people will be eligible. We may determine that the booster shot is effective. We've seen that when you test booster shots in people who are immunocompromised, to have a poor immune system, probably about close to almost half of them, maybe slightly less, will get an increase in their antibody levels. I think one of the reasons you're seeing a little bit more cautious approach here in the United States is, I haven't seen anything published yet that shows that if we give you a booster shot, a third shot, that it actually reduces your risk of hospitalization or death. So I think that's some of the information that some of the scientists are really waiting for before they're really going to push for the boosters. That's the type of information we need. So as always, to follow the science, we still have a little bit of ways to go. I think to think about the future, they've looked at what's happened in the United Kingdom and also in India, where they've seen some declining rates of infection. And so they think in those countries, because of people getting vaccines plus people getting infected, you add that together, you get herd immunity. So I think that that's what we have to look forward to here in Massachusetts and other parts of the country that are even behind in vaccinations. Eventually, we'll reach herd immunity. Hopefully, things will really quiet down. Thank you for having me, and I'm happy to take questions later. Bye.
Thank you, and that's Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess, and he's available to answer questions along with the other members of our panel. And at this time, we're going to go to one of our weekly regular guests, Dr. Barry Potvin. Dr. Barry Potvin is Professor Emeritus from Yeshiva University, and he is also serving as the chair of the Plymouth Board of Health. Welcome, Barry.
Yes, thanks, Steve. I'm going to try to do this again as efficiently as I possibly can. So there's going to be a screen share, which I am definitely going to try to make visible.
Yes, we can see
full
it.
Screen. Okay. So I'll go through some numbers with you. I really want to make sure that everybody understands that everything that's being shown to you is coming from CDC information, or from the State Department of Public Health, or from information that's flowing out of our own Department of Public Health here in Plymouth, or from epidemiologists, physicians, and public health experts. So these are just the numbers as of yesterday for the number of cases and deaths in the US, Massachusetts, and Plymouth. I just want to point out on this one that 5,404, I was somewhat shocked yesterday when the public health nurse released our numbers and showed that just yesterday we had 31 new cases, which we haven't seen since last April on a given day. So that's certainly somewhat troubling. We don't know if that's going to hold true longer. This shows you for the state data. Down here, you see the somewhat increase that shows the beginnings of what's commonly known as the fourth surge in cases. We don't know how high it's going to go. We don't know how long it's going to last. But there's definitely been increases in cases. Currently about, I think, 1,100 per day are being seen in Massachusetts. This is just the town of Plymouth. Data that I've shown you at every meeting. Notice that it's got this kind of orangey pink background. And again, you notice that we're seeing the same thing here. The number of average daily cases per 100,000 over 14 days has now gone up to 11.5. The Delta variant, the latest information on that is that in the US, it's causing 93.4% of the new cases. In Massachusetts, the data seems to indicate that it's about 74%. It is considerably more transmissible than the Alpha variant, which accounts at the moment for only about 4.2% of our Massachusetts cases. They're all arising by random mutation as the virus replicates in infected individuals. So even when you think about worldwide numbers, the more people that are infected, the more variants there are going to be. I won't go over some of the stuff that Dr. Phil talked about, but 99.9% of hospitalized patients in the US are unvaccinated, whereas in Massachusetts, it's actually 99.992% of hospitalized patients with COVID are unvaccinated. 40% of our hospitalizations are in the 18 to 49 age group. They have lower rates of vaccination, and Florida, Texas, Louisiana, Alabama are all having an awful lot of trouble. So there's recommendations that you should wear face masks indoors in crowded conditions. Why is this happening? What's happening with people that are fully vaccinated? large numbers of virus particles accumulate in the nasal and throat passages, even though you don't have much in the way of symptoms. And that means that, of course, you can spread the infections fairly widely. We think that to get to herd immunity, we need about 90 to 95% fully vaccinated because of Delta. In the US, the number is now 50%, Massachusetts 64.3%, and Plymouth is 59%. A lot of things have been happening in Provincetown. They've got it under somewhat control. They did put some fairly strict indoor mask advisories in place to try to control it. You notice that if it's above 3% positivity rate, they put in place a mandate for face mask wearing indoors. And in Plymouth at the moment, our number is 3.85, although we don't have a mandate for mask wearing yet. These are the things that we're talking about at the Board of Health. The fall town meeting is being talked about today, later on this afternoon, but it'll either be a mandate or it'll be a strong request that the fall town meeting be held by remote access. The select board and the town already put in place a face mask warning for town hall and other municipal buildings. The Board of Health did put in place an advisory for face mask wearing indoors, covering both mouth and nose, at bars, nightclubs, gyms, health clubs, grocery stores, etc. We'll be talking later on about this travel advisory where you should get tested if you travel to a state where the COVID test positive rate is above where it is that you come from. And the latest thing in Massachusetts down on the bottom, indoor mask mandates are now in place in Belmont for people 2 years of age and older. In Provincetown, if their positivity rate exceeds 3%, in Nantucket, and as of last night, the Board of Health and the Select Board put in place the same sort of thing in Salem, which will go from the 23rd of August until the 13th of November, of course, covering Halloween. These are the states color-coded where there's either high risk of transmission or moderate risk or elevated substantial risk. And there's one up here, which is Vermont, that's moderate. This was the data I showed you last week about what's going on with transmission levels in Massachusetts. This is the new one that just came out on the 6th of August. And you could see that it's gotten considerably worse. This is a state synopsis. I'm not going to go through this because there's not time. On this, which is our vaccination data, which came out from data on August 3rd, the thing that concerns us now is the percentage of fully vaccinated people in the 12 to 15 year age group, which is a concern, of course, for our school systems. Most places in Massachusetts, this number is up around the 50% range, so we're quite a bit lower. We do have, as I said, 67% of our population now fully vaccinated. In terms of getting vaccines, where can you go? Most of these big ones have closed. There is still a bunch of CVS's, a Walgreens, a Walmart that are available in Kingston. After they took down the Kingston collection site, opened one at the intermediate school, open on Saturday and Sunday only. This is where you can go for COVID testing. This is the last slide. So if you travel and you come back and you want to make sure you're not infected, you can go and get home testing available at no cost eligible Massachusetts residents. They will provide you with a kit. The kits are reserved for adults 18 and over who live and work in congregate settings or experience the symptoms, have been in contact with someone with COVID-19, or have otherwise been recommended for testing. The home test kits you can get at CVS. The Binox test kit is $24. The L-room test is $30. If it comes positive, you have to get tested again by the molecular test. Closest stop, the spread-free testing site is at the Plymouth Walgreens. You need appointments. It's available through the 30th of September. And area CVS stores all do testing, but they have out-of-pocket expenses from $105 to $210 unless you have symptoms, recent contact with infected persons, or international travel reservations. So that's all I'm going to have time to cover today. There'll be a lot more this afternoon at the Board of Health meeting. Thanks, Steve.
Thank you, Dr. Barry Potvin, Chair of the Plymouth Board of Health, which has its regularly scheduled meeting this afternoon at 4 p.m. on August 11th. And at this time, we welcome back Plymouth State Representative Matthew Muratore, who will tell us about the state of the state. Welcome, Matt.
Hey, Steve, how you doing today?
Good.
Good to be with everybody. Let's start with some good news. Is that we actually have today we'll probably hit 4.4 million people in Massachusetts will be fully vaccinated. As you know, there's 7 million people in Massachusetts, so that's about 63% of the entire population, and it's about 70% of those that are actually eligible to be vaccinated. So we're still climbing every day. The first doses, we have 4.6 million people with one dose. So that goes to tell you that we'll probably end up hitting 4.6 somewhere around Labor Day. I know Barry showed Chairman Potvin showed the graph about children getting vaccinated. It's low, but we're seeing on a state level that the numbers are starting to exceed on children getting vaccination, particularly the first dose, which means the second dose is coming. So we're hopeful that we're going to see those numbers climb up towards the end of this month as well. The 7-day average of positivity rate for COVID-19 is 2.88%. And to put that in perspective, it was once above 30% and as low as 0.5% just recently. There are 334 hospitalizations, and that is one of the lowest rates in the country for hospitalizations. Massachusetts is the lowest at this point, so that the numbers are not going up. At one point, we were almost at 4,000 people in the hospital in the Commonwealth, and the lowest we were at was in this past July. We're averaging 85 folks in the hospital per day. So the number is going up, but very slightly compared to what it used to be. 78 of those are in intensive care, and 33 of those are intubated. So those numbers are staying relatively low. When you look at those that have been fully vaccinated, that almost 4 million people, to date, the state's been tracking these numbers. There's been almost 10,000 cases of COVID in those people that have been fully vaccinated, with 445 of those being in the hospital. But the percentage of that is 0.01% of all those that have been vaccinated have been hospitalized with COVID-19. And the deaths, 106 deaths, which that translates to 0.002%. So that kind of gives you puts it in perspective of where we're at. Again, more information can be found on mass.gov. You can find a lot of this data. Chairman Potvin did show where you can get vaccinations. They're readily available. We encourage people to continue to do that. And I do want, as a side note, Steve, too, numbers just came out today, too, with something that we seem to put aside, but overdoses are really climbing fast. In the first 6 months of this year in the Commonwealth, we've had over 1,000 overdoses. So it's something that we still need to tackle and will continue to tackle. So I just wanted to mention that today as well. And that's the update from the state.
Thank you, Matt Muratore. And at this time, we're going to go back to our guests and do questions that have come in. And the first question, and we'll ask beginning with Dr. Philip Triffletti, what precautions should parents take if they have younger children who cannot yet get the vaccine? Dr. Phil.
I mean, that's a really great question. And, I think, the good news is that, these younger children, while they're not, completely unsusceptible. I mean, they do have a risk of infection, like adults do. They have tended to be milder infections. And, it's really the elderly and the immunocompromised, like I talked about. I think these are the highest risk people for getting infected. But, I think if people wanted to take additional precautions in their home, people could decide to wear masks. I think for people, say if you have a family unit with, parents and children below the age of 12, I mean, the likelihood that those parents will ever get infected is probably, as I said, 10% or less if they've been fully vaccinated. So, it's not likely that they'll get a breakthrough infection. Matt gave you the numbers for what breakthrough infections have looked like here. And so, I don't think it's essential, but I would just say if people were worried about it and they wanted to protect the children further, they could wear masks at home. And, I think for older children, obviously wearing masks when they're indoors, I think all of us really should be. Now, with the numbers climbing as much as they have, I think we all should be wearing, masks indoors. And, that's where the biggest risks are for transmission. I think, when you're outdoors, not so much risk, but indoors is where the risk is.
And a second question for Dr. Phillip. Do we think that there will be another hold or moratorium on elective surgeries?
Well, I think that's pretty unlikely at this point. I mean, those numbers that Matt was quoting to you for Massachusetts, very low rates of hospitalization. So, because we have so many people vaccinated in our state, we're hopeful for, a significant period of time going forward that, we'll still see very low rates of hospitalization, very low rates of deaths in our state because we have such good vaccination rates. So I don't think you'll see that here in Massachusetts. It is happening, unfortunately, in other parts of the country. There are states where their vaccination rates are probably half as good, as what we've achieved here in Massachusetts. Those states are getting overwhelmed with patient admissions with COVID, with these unvaccinated people getting admitted. And in some of those states, yes, they'll have to postpone elective surgeries, but I think here we're very safe on that.
Thank you. The next question, again, for Dr. Triffletti. If a person is fully vaccinated and is knowingly exposed to someone with COVID, what is the likelihood they'd get a breakthrough infection?
Great question. So the likelihood of a breakthrough infection, if you're exposed and you've been fully vaccinated, as I said, if you're not immunocompromised, if you have a normal immune system, it's probably about a 10% risk. If you have a compromised immune system, then your risk can be as high as 40%. So there's a big difference whether you have a normal immune system or not if you're exposed. And the other thing I'll just add to this question, which I get all kinds of questions all the time about COVID. I had this question come up recently. What to do if you're fully vaccinated and you get exposed? Do you have to be tested? And it turns out that the new recommendations do suggest that you go and get a test, like a PCR test, about 3 to 5 days after your exposure. So that gives you a little bit of margin of safety if you've been exposed, even though the risk might be only 10%. If you have a normal immune system, you can, try to protect others around you by, getting tested about 3 to 5 days after the exposure.
Thank you. Next question for Dr. Barry Potvin. And Dr. Potvin, the question from the viewer, do you recommend that masks be worn in the workplace even if fully vaccinated in the town of Plymouth?
Well, the town has already enacted that in terms of, town-owned buildings. In terms of businesses, yeah, sure, we'd recommend that. That's entirely up to the businesses. There's no state mandate for that. There's currently no, mandate from the town for that. But certainly it doesn't hurt to be safe. So also, in just adding something to what Dr. Phil just said about the question from the parent, one of the big things about keeping your children safe and keeping schools open is to also make sure that you're fully vaccinated, because that's the best way to keep infections from spreading in your home, which might affect your children, and they may carry it to the schools.
And further responding, Plymouth Representative Matthew Muratore on the issue of masks in the workplace.
Yeah, I think the CDC guidelines have been very clear on this, is that, they recommend having face masks indoors, anywhere indoors. And, but particularly if you have somebody that's at home that could be vulnerable to, to COVID-19, that has some health issues, then even if you're vaccinated or not vaccinated, then you probably should be wearing a mask indoors or in work. even if you are vaccinated, but it's really your living situation. So you want to really follow the CDC guidelines on that.
Thank you. And now we're going to go back to each of our panelists for a closing statement. We're going to begin with Dr. Philip Triffletti, attending physician at Beth Israel Deaconess. Phil.
Yeah, thanks, Steve. A couple other points I want to make. I've been very happy to see a lot of mandates coming from large businesses across the country, and obviously hospital systems here, like my Beth Israel Lahey Health System, is going to mandate. There's been a very important data I saw this morning about nursing homes, and it showed that in other parts of the country where the staff at nursing homes don't take the vaccinations as much as they do here in the Northeast, they have 5 times greater infection rates now among their nursing home residents, again, a vulnerable population. Here in the Northeast and Massachusetts, we're only seeing about a doubling of infection rates recently with, the Delta variant becoming more prevalent. So the point there is, these people need to be, in high-risk circumstances. I think healthcare workers, nursing homes, I believe the state is going to mandate by October, I think 10th, that all staff have to be vaccinated. And, these people, if you're around, it was kind of like, what Barry was talking about, making sure the parents are vaccinated to protect the children. I mean, these healthcare workers have to get their vaccines. And so I'm fully in support of all of the efforts. The government's going to have the military have mandatory vaccinations, government employees at the federal level, they're working towards mandates for vaccinations. I think this is all terrific. So personally, I'm very much in favor of the mandates. The last thing I want to point out is just about masks. People ask me sometimes what's the best masks. It's a little complicated. I think making sure you have a good mask fit, you make sure that you take that wire over the nose and press it down. A lot of people, the mask, drops down below the nose, and then it's not going to be effective. You've got to have the mask over your nose. You've got to have, that metal wire firmly adherent to the shape of your face. And people with beards, I have a fairly close trimmed beard, but I've even thought about shaving it. Bushy beards, you're not going to get as good a protection. Something else to think about to get the tight fit. You can wear, for high protection, you can wear a disposable surgical mask and on top a cloth mask, and that's probably more protective than most of the other masks that are available. And thanks again for having me on the show, and I wish everybody good health out there. Be safe.
Thank you, Dr. Philip Triffletti, attending primary care physician, Beth Israel Deaconess. We're going to return now to Dr. Barry Potvin. Barry, how about your closing statement for today?
Yeah, thanks, Steve. Well, I think that generally speaking, the good news is that in Massachusetts and New England, as you might have seen from those charts, we're an awful lot better off than most of the rest of the United States. Our risk levels are lower generally. So as long as we remain somewhat cautious, we should be okay. I guess the other side of the coin is that the elation and exuberance that everyone felt so strongly, probably back in May, that the pandemic was finally over and we could go back to life as completely normal as we used to, was somewhat premature because the Delta variant kind of threw everything backwards somewhat. So again, we have to be cautious. We have to use common sense. And we have to try to take care of ourselves, our families, and each other. Thank you.
And Plymouth Representative Matthew Muratore, in our final minute, what's the takeaway today from today's program?
Just exactly what Dr. Potvin said is that, we need to be taking care of each other, taking care of ourselves and our family. And if you're hesitating on getting the vaccination, go see your primary care physician, talk to them about that. Obviously, vaccinations are working. The numbers are shown here in Massachusetts as being a leader in the country on getting vaccinations, and our rates are lower, hospitalizations are lower, folks in the ICU are lower, intubation is lower. So the vaccinations are working. So we encourage people to just talk to your primary care to make that decision on vaccines. We'll see you next week, Steve.
Thank you, Plymouth State Representative Matthew Muratore. And please join us next Wednesday at noon. And once again, Dr. Barry Potvin, Plymouth Representative Matthew Muratore, and another panelist will be joining us to provide an update to the Plymouth community. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us.